The newest recommendation for colonoscopy is you should begin getting your colonoscopies at age 45 or 5 years younger than your first-degree relative that was diagnosed with colon cancer.
Other indications, if you've had colon cancer before and you've had surgery and you've not had a colonoscopy since your surgery, that would be an indication as well for your colonoscopy, and we'd be more than happy to do those.
This cancer is very common due to many underlying risk factors, which could be processed meat, eating red meat, obesity, sedentary lifestyles, smoking increases the risk. Anybody who has unexplained anemia, they could have abnormal weight loss, they could have blood in their stool, they could have abdominal pain, right side, left side.
Nausea, vomiting, bloating, feeling, constipation.
There are genetic mutations that causes colorectal cancer, so you will see colorectal cancer run in families.
Colonoscopy is an outpatient procedure, so when we're done, we will send you home. You will have to do a bowel prep before the procedure.
Patients have to drink the Miralax or Suprep or some sort of prep to clean out their colon, which is done a day or 2 days before the procedure itself.
Then you'll show up on the day of your colonoscopy. We then use a colonoscope to drive the entire length of your colon, beginning at your rectum and going all the way to your right colon where your small bowel is. And we take pictures with a camera from the inside. We then slowly withdraw the scope, usually over a period of 10 to 15 minutes, and take a look for any kind of cancers, masses, polyps, or anything that looks abnormal so that we can biopsy it and see what it shows. Treatment for colorectal cancer can involve chemotherapy, radiation, surgery, or a combination of all three. And it depends on the type of colorectal cancer and how early that it is caught, which one of those things comes first.
If we find a stage 1, that's usually a small polyp that has not spread anywhere in your body. Stage 2 and stage 3 colon cancers usually deal with the size of the tumor that we find and whether or not it's in the lymph nodes. Once we do surgery, we will send off the colon to be analyzed, and then we'll also analyze the lymph nodes, and that's where the staging comes in, and that's where we'll talk more with the oncologist about future treatment plans for the colon cancer besides surgery.
We ask when you come to the clinic, do you have any relatives that have had colon cancer or that have died from colon cancer, so that we can start to begin to screen you at an earlier age so that we catch it early. The key to treating colorectal cancer is catching it early and up front as opposed to later.
ARH, more for Appalachia.